WRSR, Owasso, Flint. The following program has been pre-recorded and is paid for by Discover Flint Township. The views expressed are those of Discover Flint Township and do not necessarily reflect the views of 103.9 The Fox or Krill Communications, Inc. Welcome to Discover Flint Township, a program showcasing our local community. Flint Township is ready for your next move. And now, your host, Flint Township Economic Enhancement Director, Tracy Tucker.
I'm Tracy Tucker, and this is Discover Flint Township, brought to you by Flint Township Economic Development Authorities, HAP, Financial Plus Credit Union, Shea Automotive Group, Guaranteed Rate, and 103.9 The Fox. This morning, I have one of our great friends, Elizabeth Robinson. How are you?
I'm fantastic. How are you?
I am fantastic.
Thanks so much for having me again.
I love having you here. Even though she has been the world traveler lately, we didn't even talk about it last time. She went to Scotland.
I did.
Trip of a lifetime.
It was epic.
Oh, my goodness. And then you came back, and you had to get back into the swing. And so now,
dive right back in.
Yeah, exactly.
Just to get ready for our busy season.
Yeah, just in time for Medicare enrollment, right?
Yep. I am all over the place every day, every week.
So I was so excited about your trip and hearing about you being back and all that. I forgot to mention where you're from. For those people who haven't been listening, and where have you been?
And welcome back.
Yeah, and welcome back. Elizabeth is from HAP.
Yes.
Right? So that's part of the reason why we're talking about Medicare. But you have deadlines coming up. Very important deadlines for people to understand.
We are in the throes of annual enrollment right now, and it goes until midnight, 11:59 p.m. on December 7th. That is the cutoff. So that's the last time anyone who's currently on Medicare has the chance to make a decision about their enrollment for January 1st.
Okay. Well, is there a reason they picked December 7th?
That's it. That
lives in infamy.
Yeah. Well, I mean, no, that's so funny. I didn't even catch that. I hadn't even thought about that. No, that's the date that Medicare chose, and that's what we're stuck with.
Is it the same date every year?
Yep. Yeah. October 15th through December 7th of every year.
Okay. All right. So what are the major changes that you have going on?
Oh my gosh. So there's a couple of things that are changing for next year from CMS perspective. And CMS is the Center for Medicare and Medicaid Services. They are the government's managing arm that controls everything Medicare, everything Medicaid, everything Marketplace.
Okay.
So they control the rules and the regulations. They control a lot of the information that happens about Medicare in general. Mm-hmm. So one of the things that's changing is that they did increase the amount of Social Security payments a little bit.
Okay.
They did decrease the minimum or the standard premium for Medicare Part B for next year.
Oh, nice.
So that's a little bit nice. So this year it's $170.10. Next year it's $164, and I forgot exactly how much change, but $164. Yeah. So it's a little bit less next year, which, $6 doesn't seem like that much of a change, but exactly. And anytime you can save money when it comes to insurance, that's always a good thing.
Yeah. Oh, yeah.
So,
especially if your Social Security is going up and that's going down, that's always a good thing.
And it's usually the other way. Usually the Social Security goes up a little bit and then the premium goes up a little bit.
Yeah.
So this way both went down, which is the Social Security payment went up and the premium went down. So that even widens that increase for the net that's in your pockets for Social Security, which is a good thing.
That's great. Yeah.
So that happened. There's a whole bunch of new rules and regulations because of how chaotic the marketing has been over the last few years. So there's a lot of statements that have to be read when you're working with an agent, and phone calls have to be recorded now and kept for 10 years. So there's a lot of things like that have changed, but it's all in the hopes of protecting the consumers.
Yeah. Well, we talked about that, about the people that make the phone calls to people on Medicare and just hope that you'll say yes to something so they can tag it in where they want.
Yeah. So there's so many. I'm sure everyone is aware of the ads that happen with the old football player and the older actors and promising free this and free that, and call to look up your zip code to see if you qualify for free this. those are really just really super aggressive sales tactics.
Right.
And the people who are answering the phone calls, answering those calls from that ad, they are not there to necessarily work in your best interest. Mm-hmm. I still stand by the fact that the best way to get assistance in trying to figure out what's best for you, if a change is good for you, is to work with a local agent.
Right.
The people who answer those phones from those commercials, they are getting paid to switch you to something different that may or may not be good for you. Mm-hmm. And they're going to tell you that it is because that's what they're getting paid to do.
Well, and your local agent is going to know you better and know
exactly
your needs better, right?
And they're going to know the details of the plans that are available for you better. And they're going to be able to make sure that the doctors that you use are in network. Whereas you call these phone numbers, they're going to say, oh yeah, your doctor's in network without even looking at anything. So they're not going to verify anything. They're going to tell you that they have, and then you're going to be stuck in a plan that doesn't work for you. Or you get a plan where you think you're getting all of this extra stuff, but you're actually giving up a lot. Like maybe you get money back on your Part B premium, but what they don't tell you is that now all of a sudden you have a medical and a prescription deductible that eats up anything that you might have saved on that buyback. So it doesn't necessarily work in your favor to go with these, what they're promising, the sun and the moon and the stars. And chances are you already have a lot of those benefits in your Medicare Advantage plan.
You're just not aware of it.
You just might not be aware of it. So talk to your agent or find an agent. And if you don't have an agent, call HAP. We'll be happy to get you connected to one of our trusted agents.
Yeah. Because you have a lot of local agents that have all the different products, right? Absolutely.
And one of the things that's really great about working with an agent, an independent agent, is that they are not obligated to any one carrier.
Right.
They may have a preference, they may have a carrier that they prefer, mm-hmm. but they're always going to work in your best interest. Mm-hmm. They're always going to make sure that you get into the plan that works best for you. Now, we hope that it's HAP. Obviously, right. We hope that HAP is going to fill all of your needs, but we understand that that's not always the case. And so the local agents, they can compare and contrast for you. They can make sure that your doctors are or are not in network. They can make sure that your prescriptions are covered under the formulary list. They can map out your prescriptions and say, yep, on this plan, it's going to cost you more than on this plan. They can do that comparison for you, that high-level comparison. And that's the specialty of working with an agent. Right. Someone who is trusted, who is local, who knows you. And there's so many great agents around that are so good to work with.
And they came out with the new rules October 1st, right?
Yes.
So you had until October 1st, until December 7th to kind of take the time to do these things. You still have time.
Yeah, absolutely. Absolutely. You have until December 7th, mm-hmm. and literally 11:59 p.m. December 7th. And there is a following window called, so this enrollment period that we're in right now is called the annual enrollment mm-hmm. period. There is also a different enrollment period that happens following from January 1st through March 31st called the open enrollment period. Okay. We're not allowed to advertise this in the sense that we encourage people to make a change, but to be able to inform people that it is there. So if you do select a plan, whatever that plan may be for January 1st, right. and then for some reason you find out that it's not working for you the way that you were told it was going to or the way you thought it was going to, you were told your doctor's in network, now you found out he's not, whatever the case may be, you have the opportunity to make one additional change that takes effect the first of the following month. So you're not stuck in a plan that doesn't work for you for the whole year. It's kind of like one opportunity to course correct, right. if you will. And again, an agent working with you can help guide you through that and make sure that you are, if you need to, that you change back or make another change.
That's great, because usually a lot of times when you get, especially government programs, you get into it, you're stuck. Right?
Yeah. I mean, well, and generally speaking, once you choose a Medicare Advantage plan, especially, you're locked into that plan for that calendar year, right. unless you have a life qualifying event that triggers a special enrollment period, or you utilize this particular time, which happens in the beginning of the year, to make sure that you're not stuck in the wrong plan.
Right. So, and, you know, a lot of times people make a switch because they feel pressured or something like that.
Yeah.
And then they realize after they've made the change that, oh my goodness, what have I done?
Absolutely.
Yeah. So that's great that they have that available.
And especially if you do, you know, and I can't stress this enough, to avoid answering unsolicited calls. Try to avoid them. If you do, don't say the word yes. Don't agree to anything. Even if they say, "Can we just send you some material?" If you agree to that what happens is that these bad actors can manipulate that recording and make it sound like you agreed to move to their plan,
Right.
and they'll move you to that plan with or without your knowledge or permission. And so what happens then is that people then find out that they got moved to a plan and they didn't even want to. So now they're in a plan that they didn't ask for. So that's why this opportunity is there, is to kind of correct that and make sure that it doesn't impact you for the rest of the year. Working with an agent can help you work through that. So
that makes sense. And, you know, there's so much information out there and just flying around everywhere. And like you said, they're out there telling you this is free or it's not going to cost you anything or this and that. And if you're helping a loved one with this, go with them to the agent or get on the phone with them while they're on the phone with the agent. I think that helps, right?
Absolutely. It's really important to make sure, especially if you're working with maybe your parents are on the older side. Like my mom is 89 years old. If she were to sit down and talk with an agent, she would try her darndest to understand, and she would make sure, but she would not understand everything. Yeah. In fact, she's been on Medicare now for 24 years. And until I started working in Medicare about 5 years ago, she had no idea what she did or didn't have.
Right.
She had no idea what the options were. She had zero understanding of it. So working with that agent does help that process. But if you have someone else who can help you take a look at that and help you evaluate, especially if it's someone who does get confused by the insurance or doesn't, you know, a lot of times when you're dealing with the older generation, a lot of times you're working with one of the two pieces of that marriage. One side or the other usually took care of all of that stuff.
Right.
And then maybe that person has deceased and now the other person's left and doesn't quite understand it all and just kind of leaves it where it was. That person may be missing out on some additional benefits. So having a someone in their family, like a caregiver type role, help take a look at it, that can really make a lot of difference.
Well, and I find too, just in general, I mean, even for, you know, someone like me, if I'm talking to somebody about something important like insurance or something like that, finances, that type of thing, sometimes when you're having those conversations and it's just one-on-one versus you have another person, a lot of times you just miss something.
Yep.
Because you hear something, your mind starts thinking about what they just said. They're still talking. You're not hearing everything they're saying. So I think it's always good when you have something that's that important, like health,
absolutely,
health care, insurance, financial stuff. Always have somebody else with you
who can pick up all those pieces that you're missing, maybe.
Yeah.
Or maybe you misunderstood something, or maybe you got distracted and were writing a note about this, so you didn't hear a piece. It's I always say the same thing about like healthcare. So like if my mom is going to a doctor's appointment, I want to sit in the doctor's appointment with her because she's got, I don't want to say selective hearing because she's got hearing issues, but sometimes she'll get so focused on something and she she thinks that she understands what is listening and hears what's being said, but she misses some of it. Yeah. So being able to kind of be that fill in the blanks person and help verify everything really does help a lot.
No, I think so too. I mean, I find it just in everyday conversations, we kind of laugh about it, my husband and I, because like he'll hear something and I'll hear something and it's two different things.
So often.
It's like we hear two different things when we're talking. And sometimes we'll be sitting there and we'll talk and I'm like, I'm saying the same thing you are, just in a different way. Right?
And that happens. And that happens sometimes. And sometimes it just is a matter of asking a question again or just going back to the basics. You know, there's all kinds of ways that you can help a loved one by understanding it better yourself so that you can lend that support to.
Yeah, and I would say too, if you're a caregiver for somebody or you help them out with these types of decisions, that you can call, right? They can call an agent and ask
absolutely
questions.
Ask
right?
questions. Absolutely. Now, I will say that if someone is calling HAP on behalf of a member and asking for specific information, we either have to get permission from that member or whatever because of HIPAA law. Right. But if you're working with an agent, absolutely call and ask those questions, because maybe you're thinking of questions that your loved one never even thought of asking, but they just kind of gloss over because it's part of their everyday life. So, there's questions that you might miss.
I get ahead. I'm thinking of something else. And don't you have like videos and stuff like that on the website that people can go into kind of research if they wanted to do research on their own?
Yeah, so there are some videos on YouTube, on our YouTube channel. I've actually done some of the videos myself, like kind of a Medicare 101 approach. But we also have seminars that we do throughout the year, and also, especially during this time of year, the annual enrollment period. So if you want, there's seminars and webinars. So you don't even have to like go anywhere. You can do it through the convenience of your home.
Yeah, I like that.
So the webinars are really great. We have a really wonderful agent who does those right now. We've got seminars that are done all over the place, all over Southeast Michigan and West Michigan, all over our service area. So if you go to hap.org, you can find the information there. You can also call our phone number, and the agent that you're speaking with can also get you signed up and registered for any of our seminars that are coming up.
So in-person seminars.
Yep, in-person seminars. Or virtual webinars. We have those scheduled all throughout the end of the annual enrollment periods. I think our last one is scheduled on December 3rd right now.
See, I like the webinars because when I'm sitting in a seminar, and this is terrible, but I'm sure other people do it too. I'll be sitting in a seminar and I'll be taking my notes and I'll hear them say something and I'll miss something. And I know I missed it. But you can't back it up, right? Whereas if I've got a webinar and they're talking and I'll be like, wait, what? What'd they just say? I can back it up and I can re-listen to it as many times as I want to. So I love the webinars.
Well, our webinars are actually, they're via Zoom and they're live.
Oh, they're live.
So it's live. It's not a recorded, but there are recordings out there on YouTube. So there's information out there on YouTube. And one of the great things about the webinars and the seminars is that it's done by one of our local trusted agents. So in that, you are also being introduced not only to the basics of Medicare, not only to the information about HAP Medicare plans, but also building a trusted relationship with one of these agents. So you've got that agent's connection information, and you can connect with them later, make an appointment, follow up, ask questions. So the Zoom calls and the seminars, the agents always encourage for participation from people who attend.
Yeah.
So they want you to engage. They want you to ask the questions. They want you to say, I'm sorry, can you repeat that? So there's definitely a way. Yeah. And honestly, what's really great about it is that if there's multiple people attending that seminar or that webinar, if you have a question, chances are very high that anyone else who's attending has the same question or might not have thought of that question, but also wants the answer to it. So it's a great conversational moment to have the ability to kind of ask and share that information with each other.
Yeah, that's great. So you have the in-person seminars, you have the live webinars that are on Zoom, and then you have the videos themselves. These are all available on hap.org, right?
So yeah, the registrations are available on hap.org. The YouTube videos are on our YouTube channel. So if you just search HAP Medicare 101, they should pull up really easily.
Yeah. So what's your YouTube channel? HAP?
Yeah, just HAP or Health Alliance Plan -HAP, one of the two.
Yeah, I think it's Health Alliance Plan -HAP.
Yeah, I think it is too. I know that our Facebook and our LinkedIn pages are Health Alliance Plan -HAP.
Yeah.
And there's information about all of the webinars and seminars on our Facebook and LinkedIn page too.
Yeah, that's cool. It's amazing what we can do with never leaving our house.
Oh my gosh.
And this is bad in a way because you don't have to interact with other people to get information. And it's good in a way because you can do it on your own time, but it's bad in a way too because you don't build the relationships like you're talking about.
In person, it's different.
Insurance, and part of your health care is the person that you're dealing with knowing what your issues are.
Yeah.
So you kind of need to have some interaction there to make sure you have the best product, right?
I think so. And I always approach dealing with any of my clients like looking at a 500-piece puzzle.
Yeah.
Like, I know how to ask you the questions to be able to identify the puzzle pieces, and then I can help you put the puzzle together.
Yes.
So that's what the agent does, is kind of take a look at your life, the information that you're providing them, and say, okay, so I'm going to gather this all together here, and this is going to be a good option for you. Or here's 2 or 3 plans to compare. What do you think is the best for you?
Yeah, that is so funny because I and you have to be willing to give them the answers, right?
Yes.
You have to be willing. Let me tell you, I'll tell you, this is a quick story. I have somebody in my life that does not like doctors, that would not tell them what was wrong.
Oh, no.
And just go to the doctor. And, they should know what's wrong with me.
So expect them to divine it.
My husband told her, he says, if your doctor wanted a patient that couldn't communicate with them, he'd be a veterinarian.
That's hilarious. And kind of true.
Yeah.
You know?
So you got to be willing to give them information if you want them to be able to help you.
Yeah.
Right?
And I always felt so bad. I'm like, okay, I'm not trying to be nosy. I'm just asking you this information so I can really put everything together for you.
Right.
So especially when it comes to like, in trying to advise about like premiums versus income and that kind of, I'm like, I'm not trying to get nosy. Yeah. I don't need to know what you take the medications for. Just help me know what the medications are so I can tell you help you understand what to expect to pay for them.
Right. Because if you don't know what the medications are,
I cannot even begin to guess.
Yeah. You wouldn't be able to, because some specialty medications might be covered under one plan, but they're not covered on a different
Or they
plan.
might be a tier 3 here and a tier 4 there, which makes a huge difference in out-of-pocket costs. Yeah. But also what is the cost of medication in general, not the wholesale cost, and then that impacts the overall cost out of your pocket over the course of the year because of a whole process called the donut hole, which is a whole separate conversation that we can have next time. But there's a whole process, so that it's being able to predict and kind of map out your out-of-pocket experience for your medications. There need to be some specific information provided in order for an agent to be able to do that. So there is some give with information, but it's never in the attempt to be nosy.
Right. Well, I think you're being kind of nosy, but
Gee, thanks.
No, I mean, seriously, though, you do have to have the information. You can't put the puzzle together without the pieces.
Exactly.
Right? And, knowing if they have a specialty doctor, if they have a specialist that they're using, or knowing if they have certain prescriptions.
Yep.
One
of the questions I would always ask would be, okay, generally speaking, do you use a lot of services during the year, or do you pretty much go to like 1 or 2 doctors a couple of times a year?
Okay.
Those are the kinds of questions that kind of help me as an agent evaluate your usage of your benefits. And if you say, I've got X, Y, and Z diagnoses and I see 7 different specialists every year, I know that you're going to have a much higher out-of-pocket experience than someone who's like my brother, who says, no, I never go to the doctor. I really should, but I never do, and I just don't like it. And, he's generally very healthy. Mm-hmm. So barring some sort of barring some sort of exception with his, health, like an accident or a significant change in his health status, he's pretty healthy consistently, so he doesn't have a lot of usage.
Right.
So that helps me identify, okay, well, you could have a plan that has a little bit higher out of pocket if you get a little bit more benefits here, there, otherwise, as opposed to someone who might want to have less out of pocket experience because they do use a lot of services. So it's questions like that. Again, I'm not trying to get your medical history, just get an idea of how you use it. So things like that are what agents are looking for. Right.
Well, and so what are some of besides that, what are some of the questions that, if you're looking to make a change, what's the information that you need to have to give to the agent. So something that you might not think is important, but they need to know. What would be some of those things for you to know when you call them?
So one thing would be is, okay, let's say I have a Medicare Advantage plan, and I want to evaluate whether or not I'm in the right plan. So some questions to ask yourself are my doctors in network? Do I have access to the doctors and the facilities that I want to go to? Okay. If not, that's a really big thing right there to identify. Are my prescriptions covered? Or has there been a change in the formulary list or the plan that I have where my prescriptions were covered, but now they're not? Okay. So that would be something else. Another thing would be, my brother just did this. He has a neighbor who she gets a flex card on her plan and says to him, well, why don't you change over to my plan because I get a flex card and I can go shopping with this. Well, there you go. So I don't have that on my plan. I would like that benefit. So what are my options? And just a little FYI on the side, HAP has a brand new plan this year that does have a flex card in it. So nice. if that's one of those things that would be really important to you, a conversation with an agent can help you identify that, in fact, we have a new plan that has that flex card. Maybe that's something you'd like to move to.
Oh, that's pretty good. I didn't know that. I hadn't even heard of that.
Yeah. So. It's actually, it's a result of our brand new relationship with MSU. Henry Ford Health, HAP, and MSU Healthcare have just entered into a 30-year relationship, 30-year partnership. And as a result of that, they co-branded a Medicare Advantage plan with us. So it's the HAP MSU Healthcare plan.
Nice.
So yes, it does have the MSU logo on it. And you do get a green flex card. But that's the only thing to do with MSU. So if you're a U of M fan, don't worry about it. Just ignore the color, ignore the name, and it's a great plan to get on if you want to get that flex card.
That's funny.
But it does have the MSU name on it. So it's a new plan that we have that has that flex card, that has that ability to give that different flexibility with that over-the-counter benefit, as opposed to our traditional plans that we've had in the past where you have to use the over-the-counter benefit through our catalog. Okay. So it's a little bit of a different access and a little bit richer benefit than the other plans. So if that's something that's important to you, thinking about what's important to you to change, what you're unhappy with or what you're happy with, and how to compare that.
Yeah, and write those down before you contact the agent. That way you can get through that list and get your answers.
Exactly.
Because, otherwise, sometimes you forget what you were talking about.
Yeah.
Well, this has been just a great conversation.
As always.
The deadline is December 7th, 11:59 p.m., right?
Absolutely.
All right.
Literally.
Literally. And this has been Elizabeth Robinson from HAP, since I forgot to tell you guys that at the very beginning. But it's been great having you in.
Likewise.
And HAP.org is the website.
HAP.org and 1-800-888 I can't read that. Can you read that? My vision is bad.
1-800-868-9885. Again, 1-800-868-9885.
Thank you for reading my own number to the audience.
That's all right. Well, I want to remind our listeners that if you have any questions, you can email us at discoverflinttownship@gmail.com or visit us on Facebook at Flint TWP Events. We do have the elf hunt coming up. I'm talking about that next week more. Our YouTube channel is Discover Flint Township. Our Spotify and Anchor channel is Discover Flint Township. You can visit our website at discoverflinttownship.com. Our Flint Township website is flinttownship.org. And I want to thank Elizabeth again for coming in. And thanks to our partners, HAP, Shea Automotive Group, Financial Plus Credit Union, Guaranteed Rate, and 103.9 The Fox. You can discover Flint Township with us next week right here at 7:30 a.m. on 103.9 The Fox. I'm Tracy Tucker, the Flint Township Economic Enhancement Director. And first of all, I want to say we're going to be talking about the elf hunt. It's coming up. Get ready to find those elves. I want to remind everybody, though, to stay safe, stay healthy, shop local, buy local, and discover Flint Township. We'll see you later.
This has been Discover Flint Township with Tracy Tucker. For more information, visit discoverflinttownship.com. Flint Township is ready for your next move. The preceding program was pre-recorded and was paid for by Discover Flint Township. The views expressed are those of Discover Flint Township and do not necessarily reflect the views of 103.9 The Fox or Krill Communications, Inc.